terrifying thing here. There's only this one little spot I have on my palate that it's been swollen for about, I would say, 3 to 4 years that I can remember. I thought, well, I think it's probably allergy. I eat a lot of cinnamon, and for what I've heard before, I know cinnamon can give you an allergic reaction, but it just doesn't go away. So I'm not completely sure about what it is.
Okay, and you've had other doctors look at it?
No.
You've had dental examinations,
I've
though.
had dental examinations.
And nobody has picked up on this in the
No.
last 3 or 4 years that you feel like it may have been developing.
Yes, no. No
Okay.
one has picked up on it.
Alrighty, well, let's take a peek, and maybe it is that allergic situation. Let me go ahead and get your bib on. Maria, why don't I give you the glasses? You can hold on to those because you'll need those in a few minutes. And what I'd like you to do, even though you're not anywhere near 40. You're what, 30?
38.
38. Oh my goodness. Okay. You are amazing. Well, let me tell you that the Visilite product is something that we use to help us look at suspicious lesions in the mouth. Mm-hmm. What I want you to do is just take this, and I'm going to pop it open, and I'd like you to rinse with it for 30 seconds. We'll time you. Just hold as much of it in your mouth as you possibly can, just comfortably, and kind of swish it around a little bit. So if you'll just take that and rinse with it, I'll time you right now. Okay. It's a little tart. Kind of like raspberry vinegar, isn't it?
Mm-hmm.
But you only have to hold it for 30 seconds, and you're almost there. Okay. Go ahead and suction. Okay, Maria, I'm going to bring you back, and I would like to go ahead and put on these glasses, which are important for me to be able to look with the Visilite. Okay. And so I am all decked out for you. This is a little chemoluminescence stick that allows us to be able to see any kind of disruptions in the tissue in the mouth. Okay? So what I want you to do is keep your chin up and open real wide, and I'm going to take this little wand and I'm going to look through your tissue and see if we see anything unusual. It looks a little bit milky up there. And that just gives us a little suspicion that something could be going on with that tissue. I'd like to take a photograph.
Okay.
Okay, so that we'll have some documentation of what it looked like today. And then the other thing I'd like to do is a brush biopsy.
Okay.
Take these off. And the way the brush biopsy works is I take a little brush and just rub it on the surface of the tissue. I smear it onto a glass slide, I fix it, and I send it off to the lab that will actually read this under the microscope. And when that is read, we'll get a biopsy report. I want you to make sure that you put on your calendar to call us in 10 days if you haven't heard from us.
Okay.
We want to make sure it doesn't get lost in the mail or anything.
Okay.
All right? And when that result comes back, then we'll go over that with you and make sure that there's nothing we need to do to further investigate this. But I would like you to stop the cinnamon.
Okay.
Just cold turkey, go off of it, and let's see what happens.
Okay.
And I'd actually like to see you in about 10 days for that, so we'll probably have the results back, so it'll be perfect. We can go over everything at the same time.
Okay, that sounds great.
Okay, Maria, this is the little brush, and I'm just going to gently rub it on that tissue, okay? Go ahead and open again. It's not uncomfortable, is it?
No.
Okay, good. Alright. Okay. All righty. Well, that's all there is to it.
Okay.
Let's go ahead and let you sit up. Maria, this is the photograph that we just took of the lesion. And here it is. I'm just going to trace it for you. Looks like it's covering a pretty good amount of your palate.
Yes.
That's the area that it doesn't look swollen, but you said it feels swollen. So there's kind of been a change in a variety of ways. It feels different. It's slightly raised, but it has this red and white appearance on it, and that concerns me. So I'm definitely looking forward to getting those results of the brush biopsy. And then once we get those back, if there's any additional concern, we will definitely pursue that, and we want to pursue it pretty rapidly. Now you're under 40 years old. You're not a smoker, correct? No history of smoking?
No.
And no history of excessive alcohol use?
No,
Just an
no
occasional
alcohol.
drink?
No,
Nothing.
nothing.
So
No.
no alcohol, no cigarettes, no tobacco of any kind?
No.
And you're young. So chances are this is not going to be an area of concern. But what it is, I just can't say, because it is unusual, so I am concerned. But I don't want you to get too worried about it. It's been there a long time, and you haven't really had any significant symptoms, so let's just wait and see. Okay?
I'll stop it.
Okay, good. All right. Maria, as you know, the brush biopsy result came back positive for some concern. So we sent you to the oral surgeon, and he removed some of this tissue, and the majority of it. And his clinical impression was something called lichen planus, which is not a cancerous condition.
Okay.
It's something that can turn suspicious, but not something that we would typically be concerned about. I'm really glad that he went ahead and did that surgical procedure, because the result that we got back was epithelial dysplasia severe. So that means that there is definitely something wrong with this tissue, and we do need to investigate that further. I know that the surgeon suggested that we just take a wait-and-see approach.
Yes.
How do you feel about that?
I'm not comfortable with it. If it's something that could turn into actual cancer, I think it would be better to just get rid of it. Go ahead and have the surgery.
I really agree with you. And severe dysplasia, to me, that says that this is a pretty scary situation. We need to
Yes.
move forward. I would not feel comfortable just sitting back and watching this. He wanted to see you when again?
About 3 months.
3 months. So he wanted to watch it for 3 months. Well, I'm definitely not comfortable with that. So if you're okay with it, I'd like to contact him and let him know that we would like to go ahead, remove the lesion, make sure that the borders are clear,
Yes.
and then take what comes after that.
Okay, thank
All
you
right.
very much.
Okay, bye-bye.
After my meeting with Dr. Samaha, she consulted with the oral surgeon, which referred me to the ENT specialist. The ENT specialist thought we should watch it for about 3 months. After my meeting with Dr. Samaha, she spoke with the oral surgeon and the ENT specialist and told them that we did not want to wait and we wanted to have it removed right away. So I went back to the ENT specialist to make my appointment for surgery. I went to surgery, and about 3 to 4 days later, he called me back with the results saying that it was positive for squamous cell carcinoma, and the borders were not clear, so I needed to go back into surgery a week later. I went to surgery, and about a week later I went for a checkup, and it's still not clear. I have to go back into surgery in about 2 to 3 weeks. In the first surgery, they removed all the soft tissue from my hard palate, scraped all the way to the bone, going into the soft palate. The second surgery, he scraped all of the borders off, and with the third one, he's going back a little farther into the soft palate. going closer to my throat. And I don't know what's going to happen after this one. And I'm really glad that I went with Dr. Samaha's decision to have it removed right away.